Our group is working on a testosterone replacement implant for transgender female-to-male individuals. My name is Leonela Sabrina Vega.
And my name is Sean.
Transitioning individuals have few available options for specific transgender hormone replacement therapy, many of which are undesirable. With an implant that controls the rate of release, the accessibility increases and cost of treatment potentially decreases. When people decide to change their gender, specifically from female to male, transgender males, one important step is taking sexual hormones of the other gender to develop and improve new secondary sexual characteristics and maintain health before and after their sexual glands have been removed by surgery. This kind of sexual hormone intake is a lifelong process that requires people to periodically take medicine and injections, which are inconvenient. Therefore, in order to improve the quality of life for transgender individuals, our group aims to developing a hormone replacement implant that has long-term hormone release in recipients' bodies. The clients for this product would potentially be all the female-to-male or transgender males who are going or planning to begin the transitioning process. Due to the lack of available options, many are forced to take injections even if they may not necessarily want to.
The development of our product is highly important since the development of these secondary sexual characteristics not only maintains a healthy lifestyle physically, but also socially. As seen here, out of the 137,000 participants, almost half of the transgender individuals reported in the lowest 10% self-rated social self-confidence. Self-image playing a large role in self-confidence gives this product a high market potential. The current medical treatment of hormone replacement therapy includes oral intake pills, intramuscular injection, skin patches, and short-term pellets. The defects of current hormone replacement therapy are obvious. First of all, due to the fact that it requires long-term and periodic treatment, it is inconvenient and not cost-effective. Furthermore, for intramuscular injection, it causes pain and requires medical techniques. So for the majority of people taking that, they need to visit a hospital periodically. For another, oral intake pills are not applicable for people with liver disease. Okay.
Our group's proposed approach is to model a device similar to Nexplanon, which is a birth control alternative. It houses 68 milligrams of a progestin called etonogestrel in EBA and lasts up to 3 years. The density of dry testosterone is 1.12 grams per centimeters cubed. Making our product with dimensions 8 centimeters by 4 millimeters in diameter allows for a volume of about 1 milliliter. Therefore, our product would be able to carry at a maximum 1.12 grams of dry testosterone that would dissolve through the meshwork as fluid comes into contact with it. For a patient who is prescribed a dosage of 50 milligrams per week, this device would last about 6 months. However, due to the metal lining of the device, the patient will have the option to return to the clinic or inject themselves with a higher or lower dose depending on how their hormone levels are. Typically, this would require a second surgery when using an implant, but the metal backing allows for a thin needle to be inserted to the implant area without inducing neural or vascular injury that typical intramuscular injections or reimplanting risks involve. A permeable membrane meshwork will only be present in the center region for a more sustained release rate, restricting the surface area by having non-porous polymer for about 2/3 of the device surface area will restrict the change in dynamics of diffusion due to the size enlargement. The larger nature of a product will be more sensible in the arm, but it will also reduce the risk of migration. In addition, the group has decided to add ridges in the areas where the meshwork is not present, both in the direction of muscle fibers as well as in the opposite direction, in order to reduce the risk of longitudinal and latitudinal migration.
The placement of this device will be underneath the skin in the hypodermis region in the tricep branches, long head, and bicep branch region, but not within the muscle itself and should not come into contact with it. The average hypodermis thickness is actually 2 mm to 10 mm. The benefits of our device include long-term desirable control release of testosterone, which necessitates fewer procedures and less interruption in a person's life. For another, the drug delivered is the same that the person had already received before with the same kind of materials. Considering about the cost of manufacturing this implant, EVA, the material used to build the housing of testosterone, costs $37 for 50 grams at a fine powders. The whole procedure for this implant is more expensive than taking the injections and pills only, but the convenience and safety it brings to recipients should also be considered as benefits. Other aspects that should be taken into consideration include sterilization of this implant, manufacturing techniques such as powder fabrication, needle puncture testing, and one-time insertion and removing surgery.
Making up numbers.
The target audience for this project include 1.4 million adults in the United States who are identified as transgender individuals. The exact amount of transgender individuals is estimated to be even higher in younger population for whom transgender issues are more accepted. The exact number of people transgender from female to male is not available because there's no official statistics given, and many people avoid to take any survey because of discrimination. Therefore, in fact, the target audience for this implant is far more than expected.
And these are our references.
Yeah.